Welcome. Thank you, Dr. Cameron, for joining tonight to talk about your Lyme and COVID epidemiological survey. It's going to be pretty impactful, and so I am excited to interview you about this. Welcome all viewers. My name is Jennifer Hoffmann. I am the programming director at Project Lyme, and I am here with Dr. Daniel Cameron, who's a renowned contributor to the Lyme community. If you've been with us for a while, you're very likely familiar with his work as a medical doctor, researcher, and frequent guest correspondent. And for those who may be new here, Dr. Cameron, please introduce yourself.
Well, thanks for leading this discussion, Jennifer. I'm an internist trained at the University of Minnesota, and over the years, I did my residency at Beth Israel, Mount Sinai. But what really applies, my favorite school was at the University of Minnesota. They had a School of Public Health, and that's where I became an epidemiologist, at least at the master's level. So marrying my medicine to epidemiology, I always dreamed of this kind of a survey, this kind of a research project. And so I was so happy to share where I'm at with this survey.
That is very exciting. And I have follow-up questions for you because I feel that many of our listeners / viewers may have them as well. So we are here to talk about a survey that you have conducted over the past year regarding Lyme and COVID patients. And you are particularly capable of conducting this survey because, as you mentioned, you are an epidemiologist. And for those who may not know, can you just explain what epidemiology is, what that word means?
Epidemiology is based on the study of epidemics. So when I first started my residency, there was an epidemic called AIDS that I thought was fascinating, but I ended up in a different direction because I was also geriatric trained. Then the next, in fact, this latest epidemic would be Lyme disease. And even more recent is this epidemic. In fact, it's at the next level of epidemics, which is this COVID pandemic. But what an epidemiologist does is it tries to look and analyze how do you get data? How do you look at data? How do you understand articles? And try to look at it from a scientific standpoint instead of just one-on-one with my patients.
Wow, that's really great. So as we proceed in talking about this impactful and interesting survey, I want to make a quick disclaimer that this interview is for informational and educational purposes only. It doesn't, even though Dr. Cameron is a medical doctor, this interview does not substitute professional medical advice or consultations with healthcare professionals, and it doesn't represent the opinions of Project Lyme as an organization. So let's get into it. So let's go over the basics of your survey. It's a Lyme and COVID survey led by Dr. Cameron. It's the largest clinically based survey of individuals with a history of Lyme disease with or without a COVID-19 infection or vaccination. So let's start with just how it all came about. What were the parameters of your survey? I can repeat these questions if you'd like, but for example, how many people were surveyed? What were your criteria for inclusion? Where did the survey take place? On what platform, et cetera?
Okay. Well, normally I'm one-on-one. I have my patients, I have an active practice, but last winter, and even leading up to it, I always had patients asking, well, what's going to happen if I get COVID on top of Lyme? What happens if I take the vaccine? Should I take the vaccine? Should I take a booster? And with so many questions, all of my doctor colleagues are facing the same questions. What I wanted to do is, because I had a lot of work in epidemiology, I wanted to maybe organize what people are saying as they share their stories. And then I could share stories that were beyond who I would see. So I worked with a platform called RedCap. that's used by professional surveys, at medical centers. And they were allowed me to put on a laptop or a smartphone an organized survey that asks an endless amount of questions. So this is the way it's done. You go to institutional review board. The institutional review board makes sure that the data is safe, it's protected, it's professionally done. It's the kind of data that you can use for research publications. So I went ahead, got it approved, got it designed, then put it on the platforms, the social media platforms. And at that point, it's called snowball. That means it gets started. One person says, well, I have a friend that has a Lyme. Maybe they'll fill it out. Then those two people say, well, I each have one. So then it multiplies. So you get more and more people. So now we've reached over 1,100 people who've completed this survey. And I was able to start working on that data. What can I learn from those patients that have been experiencing Lyme and worried about COVID?
That is fascinating. So you took your experience in epidemiology and applied that to the current climate with social media, the access to social media, using the best technology at your disposal to create a survey that would be accurate and private, and something that could actually be used to collect useful data.
Yeah, I thought that it was really an important time. Right now people are making decisions with what to do if they get COVID, if they take the vaccine. And it's so important that I didn't want to spend time trying to get grants, trying to go through a long process. I thought that using this survey process is that I could kind of get it done, get it out there. And it went out in July. It's already in February, and I already have the results analyzed, are ready to go. And instead of just putting it out as a paper at a journal that you can't even get to half the time, is that I decided that, well, why don't I just use the blog platform on my website? And that way I can not only present the data, I can have a couple of videos like discussing a case, another video discussing how it's scored, so how can you present what kind of information you have, and actually what happens over time, how many actually get sick and how many do well. And so being able to get something going, and the idea in March, launching in July and producing results now is it was very satisfying to try to get some answers out there.
That's very exciting and definitely interesting. I think that I'm a good example of the usefulness of getting information. Like the two of us even speaking together is a good example of the usefulness of getting information out, good information, of course, as quickly as possible, because the two of us were on a Project Lyme and COVID webinar in January of 2021, and which feels like even longer than just over a year ago. But back then we did not have this kind of information available. We still had questions then, we have questions now as patients, but anything that we ask of our doctors is still personal, but it's so helpful to actually have data that's collected over time that can come out and be used as the problem of COVID is still raging and not kind of in our rearview mirror, even though, yes, we hope that it will become something of the past as quickly as possible. So your explanation of the of your choice to go in this direction with the survey is really fascinating, because I was curious about how this form of information gathering was more beneficial if or not, than another. And it seems like the expediency is really the reason, right?
Yeah, I thought that since I've done research before, like chart reviews, going through charts, I did one paper that I published on 100 people who had the perfect blood test, Western blot, IgG with 5 out of 10 bands. And there were so many people who had delayed treatment. The delays were 2 years. And a lot of the delays were on relatively simple diseases, simple problems. Even rashes were overlooked. Or they said, no, that spinal tap, you have to have a spinal tap. Or that swollen knee is really meniscus. So, but that's a fairly tedious long-term process. So I learned from it that if I could connect somebody with Lyme or Lyme and COVID directly to the database, and then be able to analyze it in real time and be able to get results, cut out a lot of that tedious process, especially with over 1,100 participants. That's a lot of data to pour through. And, by having so many people, actually hands-on to give me the time so I could get right down to business.
So, and we thank you for that. So what sorts of, one thing I hadn't asked yet is, what sorts of questions are on the survey, just as an example?
Well, there's some simple Lyme questions like, how long have you been sick? How severe was your illness? Do you still feel you're chronically sick? And then simple things like sex, age. But when you get into COVID, some of the interesting problems was, were you in the hospital? And if you were in the hospital, maybe 7% had to be hospitalized. Some of them were on respiratory support, some were not. So I could actually look at that group who had admitted to the hospital and compare it to Lyme patients. So I could kind of look at, what does a Lyme patient have? And, because they're often suffering, they often have a lot of symptoms, but what's special about somebody who has contracted COVID and in the hospital? You always think, well, I'm going to worry about the COVID when it happens, but some people get really sick. And so the bigger the database is, the more participants there is, the more people I have in the hospital that I can study. There's also, I was able to look at this long COVID that you and I talked about during that webinar.
Yeah.
Is 1 out of 5 people who have Lyme with COVID report that they have long COVID, because I asked that question. Did you have respiratory issues? You have long COVID. And they were quite common. Less common than that was loss of smell, loss of taste, and very infrequent was the other manifestations. So I was able to drill down and already get information about the long haul. I'm not always happy about long haul where they don't look at Lyme again. If you're a Lyme patient, you don't think Lyme is resolved, this kind of research might get people to look a second time at whether Lyme disease is there, whether Lyme disease might still be unresolved, or did the illness, being sick, bring the Lyme disease out? And lastly, if you get a new bite and every doctor keeps saying it's long COVID, you want to make sure the doctor at least uses this database, uses this survey to say, by the way, I should include Lyme disease itself in an evaluation for someone with long COVID.
Yes, it's so tricky to try to parse out the symptoms and between long-standing infection like Lyme and long COVID when it's not so easily identified or claimed by all medical professionals to begin with. So any bit of information is going to be very helpful. So all of this being said, let's talk about your findings. Let's talk about which topics you are covering in kind of the subtopics that you have mentioned that you are going to be presenting as blogs. We'd love to tell people what the titles of those are, and then go into a little bit more into the specific findings or some examples so people know what they can expect when they learn more and actually check out your survey.
Well, I've asked people who have Lyme without COVID, without the vaccine, to participate, because then I can really capture how long people have been sick, how sick they've been, and I can get a baseline. And I was able to show what we already kind of know, is that if you have Lyme, you can be quite sick on neurologic issues, neuropsych issues, pain, fatigue, concentration. So this gives you a lot more information about how bad Lyme is. There were like 200 people in there that were over 65, so I could start describing geriatric Lyme.
Wow, that's great.
And I have, the age goes down to 12 so far. So I don't have enough children, I only have about 20 children that have participated, but if that's going to be really helpful if more and more people encourage their 12-year-old or adolescent to get in there and fill out that form, because I can capture Lyme in children. And if I expand it to younger age in the future, I can even describe that issue. Most important why I want to know a little bit about Lyme is that if somebody with Lyme gets COVID, I want to see what's different about a Lyme patient who gets COVID, or what's different about a Lyme disease patient who gets the COVID vaccine. Are there any special things that happen when you take the vaccine? Are you sicker? And if you are, how sick are you? And so it allows me as a doctor to say, hey, this is my experience. This is my experience even when I took the vaccine. But this is what 1,100 people who shared their details have to say. So it can help with the dialogue with your doctor.
That's great. And since the vaccine is can be such a hot topic and difficult, let's be honest, topic to talk about, even among friends, even though I just want to make it clear that even though you mentioned the discussion of whether or not somebody gets sicker with the vaccine is a thing that happens, that's not necessarily the outcome of the survey, right?
Right.
We're being very, we're presenting we're showing people where they can find the facts. And I just want to make sure that nothing we say either way here indicates that there's extra reason to be concerned. This is to empower people to go and see more information.
Well stated. That even though people with Lyme are quite sick by this, I'm using a standardized questionnaire from Sinai with 30 questions, is that if you get COVID, you were worse on that questionnaire, significantly worse. There was some risk of hospitalization, risk of long COVID, and that's stated the obvious. Just don't get COVID. Okay. And if you do, they might be worse, but not. The biggest issue is the Lyme anyway, not purely COVID. People going in with active Lyme were doing poorly. Now the vaccine people, I asked them, well, what are your symptoms? And as a group, they actually had better scores than those with Lyme for some reason. It could be that just a healthy population takes the vaccine, but at least their scores weren't worse. Now, that's just averages, which is, that's what happens in epidemiology. You have averages. But in this study, I also said, well, by the way, give me some details. It's called qualitative research. So I asked those who were hesitant to take the vaccine, hadn't taken the vaccine yet, or were resistant, refusing. Well, what is it that gets in your way? And so, there's always some of them about, has the vaccine been studied enough? Do I trust the vaccine? But really, the most common reason for people not taking the vaccine, or at least hesitant, was that they were concerned it might make their Lyme worse. So you don't usually hear that about other vaccine issues, other vaccine questions, but in this case, I think because people with Lyme often have been pretty sick, and it was such a disruption in neurologic, neuropsych, and et cetera, that the very thought of getting Lyme with COVID or taking a vaccine on top of their Lyme, was such a concern. And so that's the dominant issue, not your typical other questions. So I thought that was a great finding to just quantify and qualify how many people are concerned with the vaccine, and in part because of that flare-up issue.
Right. Yeah, that's definitely going to be a great resource to have, just numbers, so that people's fears and decision making can be as rooted in evidence as possible, whatever decision they make. It's more comforting to see, to not be making guesses always.
Well, these are tough decisions that people are making.
Yeah.
And probably 60% of those who had the fill out the survey had actually taken the vaccine. So it's huge numbers are taking the vaccine who've had Lyme, for many reasons. But there's still some people are on the fence, at least at the time they fill out the survey. Now, it could be that if you get Lyme and then COVID, fill out the survey, or Lyme and the vaccine, it could be that you don't really want to take anything right away until they often tell you wait a little bit until you recover from COVID. And that's so there's always more questions than there are answers. And so this takes it up one level from the patient to patterns that will help in the decision making.
Great.
Oh,
so
I should say that one of the natures of your conversation, your questions, is that I'm still exploring the information, getting to know it. I have some blogs that are going to explore each topic in more detail, because I'm still learning myself. And what does that data meeting mean? And what do patients who've been filling out this survey tell me that will help me take care of patients in my practice?
That's fantastic. So with that being said, my next question was, and I think you might have even kind of answered it a bit, but is there anything else? What in your findings has surprised you? What surprised you the most about this?
Well, I was surprised that the vaccine was as well tolerated. I had thought there would be more troubles. Now, it gets a little difficult to interpret because lots of people have side effects that last 2 days, 3 days. And that's it. So, but that's pretty common in people who don't have Lyme. So then I was looking at people who said they had moderate symptoms, moderate flare-up after 3 days. Then those who had a severe flare-up. And so, so with qualitative, I thought I'd focus in on those with severe disease or severe symptoms. And it does occur, but not as much as I thought, so that's why I thought this kind of data will help people make the decisions. This is only data. They have their own their own experience to go on, or and many people nowadays have family members, friends who either taken the vaccine or not taken the vaccine, or waiting on the vaccine. So it's I don't envy anybody making these tough choices. And then you got booster questions, and then you got the third vaccine question. So the database, the more people fill it out, I'm asking these new questions. What about the third vaccine? What about the boosters? And in this other complex issue of what happens with if you get COVID and then you get the vaccine and then you get the COVID, is that the more people fill it out, the more I can look at trying to understand those combinations.
So to be super clear, you are still looking for contributors. We can still bring in people to help, right?
Right. It's so helpful to keep the enrollment going. So even though it started in July, and my statistician is so pleased with the response from the Lyme disease community, but yeah, I can drill down to new questions so much if people participate, if they, especially children, if they can get their children to participate, that would help a great deal, both understanding Lyme, and there's very little studies on COVID in children and vaccine in children. And even I would suspect there'll probably be some long COVID people, or at least they thought they had long COVID and still only 16. So I suspect they're out there. So yes, the more, if you have a friend who's sick and doesn't want to fill out a form, and has no energy, this is a hard questionnaire to fill out. If you could help them, encourage them to, jump in and take a complicated form, or at least it's a long form, because there's so much to Lyme and COVID and vaccine to understand.
But it is worth getting all of those details right for the reasons that you've stated earlier. So can they find the survey on your website?
Yes, on my website, which is danielcameronmd.com. So it's Daniel Cameron with an MD at the end, .com. There's a really clear link. So as soon as you push that link, it goes right to hello, do you meet the criteria? And the only criteria is that you have to be over 12 and you have to have Lyme. So even if you've never had COVID, never had the vaccine, it's open to everyone, so that I can get a wider range of people who, because we're all worried about the pandemic. We're all concerned with the pandemic. And so you can take your own unique experience and help us. And so that's why that's important. That's why that Daniel Cameron MD has been helpful. People have found it, click the button, gives the consent, and you go right to the data, and the data goes right into my my center, and keep it confidential and keep cranking out new findings.
That's great. And it's great that that's confidential as well. So speaking of your website, danielcameronmd.com, that's where people can find the outcomes of your survey, right? And the blog forms and the case studies and all of those details.
Yeah, I'm trying to figure out a way to tie these issues together. So right now I have 3 blogs that I'm working on. One blog is Lyme with COVID. And then the second is Lyme with the vaccine. And the third one is concerns people have with the vaccines. Because we all have concerns. There's a lot of concerns that people have. So that first one was Lyme people who get COVID. I was going to embed several videos. Like one is discuss a case, because there's a case written, but I wanted to at least discuss it orally.
Yeah.
And because sometimes getting down to case is different than just running a bunch of numbers. And because it's private and confidential, I can discuss things without having to worry about getting consent. It's already there. It's built into the system.
They've
And then
already given consent, right?
yeah, and then I'd have a video on with what's actually happening. How many people are in the hospital? How many people? What's happening with this long COVID issue? Why are Lyme patients being told they have long COVID? And then I might do a video on with the guests, and so I can put them all. I'll keep adding videos to the blog, so that way anybody that has any interest in Lyme and COVID can keep in touch with that blog, so that it can be a blog that's growing. It also allows me to explore and learn what's going on with someone who gets COVID on top of Lyme.
Seems to me like it has a lot of benefit. The study, the survey, and the way it's being presented, it can help people in a variety of ways. It's short term by in the moment, helping people understand the broad situation of what people are dealing with, what their outcomes may be, and help empower, again, patients to make choices that are right for them. And then long term, it seems like it's very helpful to have a snapshot of where things are right now to be compared to another time. If we need to have a snapshot then, since this is an ongoing problem, Lyme, as we know, is an ongoing problem, and COVID is still here. So are there any additional short and or long-term benefits that you can let people know about?
Well, I've been working on a longitudinal part of the study, so that people who finish out the study get a follow-up questionnaire saying, well, have you gotten Lyme? Have you gotten COVID? You gotten reinfected? And what has that done to you? And if you did get one of those changes, how do your symptoms, and also just to have symptoms changed over time? Because just because you have long COVID or just because you have Lyme in the hospital and you got one finding, well, what happens to me 3 months from now? What happens to me 6 months from now? So that's called longitudinal. So this design spins off, as you said, more questions and more areas than you'd think. I'm even amazed at how many new topics I can explore with all the people who have been kind enough to fill out this survey.
Wow. Well, for everyone listening/watching, if you have the bandwidth, it definitely seems like a great idea to go check out this survey on Dr. Cameron's website, so that we can have as much representation as possible in this study and hopefully yield the best possible outcomes. And with that being said, Dr. Cameron, is there anything else that you would like to add about the survey or your findings or the whole experience overall?
Well, I think that, Jennifer, you brought your experience right out. It allowed me to clarify and explain better a rather complicated survey design. Get right down to try to connect my patients to the data.
Well, thank you for doing this. It's a huge project on top of treating patients. So on behalf of the community, thank you for putting this together. And thank you for taking the time to do this interview. It's really interesting.
Welcome. And you're welcome. Pleasure.
Same. All right.